your staff, your healthcare heroes.
Yeah, well, first of all, I just wanted to say thank you all. It's just great to be with you again, and we've gotten so used to this virtual interactions, but I can feel the love coming through, and so it's like I'm just so pumped up to see you, and thank you, and I can't wait to be with you in person. It's been lots of challenges, and that's no surprise to anybody. And there's certainly been a lot of impact on our kids, the families we care for, our communities, and our healthcare workers. But I've just been inspired about how people have risen to the occasion. And if I start with our healthcare workers, and we have a lot of people that work at Children's that live in Shenandoah country, and they come to work. They're just so positive, and they're juggling things at home, but they're not letting that get in the way of their caring for kids. And Chris and Rosie, we did a survey of our team, and we've never had higher engagement scores. People just feel like they're on a journey of purpose. That they're really they're here. They're part of Children's. Because they're needed. And, this is our 150th birthday year.
Oh, wow.
And when I think back, there were other times back in our history where we had pandemics or crises. And I just connect in with, how that mission has continued. There are a lot of kids that have been sick with the virus.
There sure have been treating them.
And I'm happy to say that we have not lost one child due to the virus.
Yes.
So
that's brilliant.
As sick as they get, and whether it's with the virus itself in the beginning, or there's a syndrome that comes later, those kids can get really sick, but they recover. Now, what we don't know is, are there long-term effects? And we're studying that, and then there's something that's that worries all of us, and that is with kids not being in school or not being with their friends or not being in their usual spaces. What is that doing to their development? What is that their behavior? And so we just want to get those kids back into schools, back into their usual activities, and so that's been a big focus for us.
Can we talk about your vaccination efforts? We know that you've been vaccinating your staff, and that you helped out with public school teachers and staff, and also some of your patients, right? 16 and up?
Yeah, Chris, we're just out there advocating and wanting to get as much vaccine as we can get, and then get it into the right people. And we started with our teams, our healthcare workers, and that was really, really positive. You could just feel people lifting up. That there was just a sense that we're just making big progress. Then we thought here, and I wish we could do this everywhere, but we had a project to get the teachers vaccinated as a way to make them feel more comfortable about being with the kids and being back in school. And then I think the great news here on the horizon, and we're just getting started with this, and we're following all the different guidelines and things. And, it's a little confusing sometimes on that note. But we're starting to think, how can we get our kids vaccinated and safe? And so we're starting with kids that may have a serious and chronic illness, and we're limited to 16 and above because that's what's been tested so far.
Right.
But we want as there's more vaccine, we want to just roll that out on a big scale. And then the next exciting thing is we're lobbying hard to be part of a study to get below 16, so we can study that, make sure it's safe, so we can get down to kids, even to babies.
Because our local children's hospital, Children's National, is also a research hospital.
Right.
So you guys have done so much great research in the past, leading to so many incredible breakthroughs. We all look to you to help lead us into this vaccination of kids.
Well, you know, and we feel that responsibility because if we don't speak up for kids, sometimes they get left behind or lost. And, you know, here's a situation where we wish we were had kids, you know, at the front of the line instead of at the end of the line. But that's just the way, you know, science is. We got to make sure that it's safe before we move into children. And to your point, we're excited about thinking through these trials to get our to get going so that it's safe and we can do that for all kids. And then we're part of a study as well to make sure that the kids that have had the virus, we're going to study them with the NIH, with Dr. Fauci's team at the National Institutes of Health. We've got a study to look at to make sure that there's not things we're missing. We want to be sure that you know, things aren't people just aren't blowing off some symptoms or something in a way when we know when it might be the virus. So we want to be very, very on that.
This is your children's hospital, Children's National Medical Center. And Dr. Kurt, thank you so much for talking with us. We know you're such a busy guy, but we really appreciate you taking some time to talk to our listeners about all the great stuff you're doing.
You're so terrific. And every time it comes around springtime, I think, oh boy, you know, I'm going to get to go up and see them, and you know, we're going to have a great time together. But there's one point I want to make too, because you mentioned it about your children's hospital. And we feel that, and we feel that responsibility. But we talk a lot about the pandemic. But what hasn't stopped is the kids with heart problems, or the kids with cancer, or the kids with seizures, or maybe it's an orthopedic problem. And we have been just stayed true to that mission of caring for those kids and those families. And, you know, that's, we want to be that resource for families and for the community, so every kid gets the best care in the world. And that's why we love this partnership. You help us do that.
Well, we love you all so
Yes,
very
we do.
much, and what you do for our kids, and keep doing it, keep fighting the good fight. And Dr. Kurt, we will talk to you again soon, hopefully in person one day.
Well, you know, I'm vaccinated, so I might be on the road up to see you soon. So
I hope so,
might
but we'll have lunch again. That'll be great. Take care. Tell everybody there we love them, and we will see them soon.
Beautiful. Thank you.
See you now. Bye.
Bye-bye.